What's up? Doc Mike. Public Health on Call. By Johns Hopkins Bloomberg School of Public Health. Today's topic for April 22, 2021. Making safe decisions during the race of infections versus injections. Thank you, Johns Hopkins Bloomberg School of Public Health.
Welcome to Season 3 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith-Rogers, producer of Public Health on Call. Today, Carrie Altoff and Elizabeth Stewart returned to the podcast to talk to Stephanie Desmond about how to make safe decisions during this strange limbo time of the COVID pandemic, where vaccinations are on the rise, but so are hospitalizations. Let's listen.
Carrie Altoff and Elizabeth Stewart, thanks so much for joining me.
Thanks for having us.
Yeah, thanks. So I wanted to talk today about sort of this strange moment in time we're experiencing with regards to COVID. There's a lot of people getting vaccinated. We're hearing about millions of people a day getting their vaccines in America. But in many places in the United States, there's a lot of new cases coming along. And so I feel like we're getting lots of different messages, and it's hard to know which ones to follow. Liz, would you start? Tell me about what you're seeing.
Yeah, it's a great question. We are, exactly as you said, at sort of a strange point with some really good things on the horizon, but also some concerning things. And I think this sort of vaccination point, and yet while hospitalizations are kind of going up in many places and cases are going up in a lot of places, people might see those as contradictory. I think one point that's really important to note is that the vaccines work. They work very well. And in fact, we see that the hospitalizations and the cases are now occurring in people who have not been vaccinated, younger populations, the people who maybe haven't had access yet or are not sort of, quote, fully vaccinated yet. Maybe they've had one shot, but not the full dose yet. So I think we are at this place where we sort of need to both recognize that vaccines work and prevent cases and hospitalizations and death. But at the same time, we are seeing these cases because there are many places and many people who are not yet vaccinated. And so that is leading to this sort of strange time with a lot that will be important to continue thinking about it in the next few weeks and months.
And so the science seems to be saying that once you're vaccinated, you can sort of do whatever you want. The CDC is even saying travel if you've been vaccinated. Are we really supposed to go out and do that, Carrie?
So what are we supposed to do? Right? I think that is, oh man, the number of times we've asked that question over the course of the past 13 months and the number of times that we've had a different answer is amazing, right? So it has been exhausting to just be on top of this and just know the right thing to do for ourselves and our families and our communities. But I think the thing we have to remember right now is that as more Americans get access to vaccination, we are still not at the point where we have reached large proportions of the population who are fully immunized, right? We're working towards it. It's amazing that there are millions and millions of doses going into arms every day. That is all wonderful. We're going to soon push over 20% of the American population vaccinated. Now, you might think that that is lower than what you expected, given the way that we've been talking about who can do what, right? So when you have about 20% of your population vaccinated, yes, we need guidelines for that group of people. And absolutely, those vaccines work. So there are more privileges, I would say, at this point that those individuals who are vaccinated are able to enjoy at a lower risk, right? Including things like grandparents hugging their grandchildren and perhaps people traveling a little bit more or just having people into your home who are vaccinated. But again, we're not at a place where mass gatherings are going to be recommended. We're not even at a place where we should not be wearing masks in public. I mean, it's because it's not just about your status as a vaccinated or unvaccinated person. It's about your community as well. And so the thing that I think is the most hopeful light is that these vaccines are just going into arms at an awesome rate. And that is a huge accomplishment. And as people continue to line up and as eligibility continues to open up extensively over the course of this month in particular, it's all amazing news. But we also have to remember that we have made good progress. We're starting to see some of it decline a little bit in a way that is really giving us a moment of pause. Our number of cases are now over 60,000 a day. We don't want to be there. We want to be lower than that. And we were lower than that in the fall of last year before our big winter surge. So we need to get those numbers lower. And with 20% of the population vaccinated, it would make everyone feel better if those numbers were lower, right? And closer to or below what we were at last fall. So we're at a careful point in this dance with the coronavirus. And the messaging is no longer crystal clear because it's now also dependent upon your vaccination status. And nobody wants to be left behind, right? We all want to be vaccinated or protected at this point from the virus. We're all exhausted. But we have to remember that there is no vaccine for a child right now under the age of 16. There are groups of the population that have not had access yet. So we are making great progress, but it is not a time, to let our guard down in a way that would result in surges, because the people who are getting hospitalized right now, the beautiful data that showed declines in hospitalization in our older adults, right? Because they're protected. And so when you hear that hospitalizations are going up again, you got to stop for a moment and think, how old are those individuals? Who are those individuals getting hospitalized? And sadly, there are a lot of, younger adults and middle-aged adults. And so we have to continue to work hard to protect everyone's health in our communities.
So Liz, I wanted to talk about sort of how we make these decisions. I know that people who are vaccinated, I know that I will soon be fully vaccinated, and the thought of going and eating inside a restaurant gives me a little bit of a panic attack. So when will we be ready, I guess, for those things if we are vaccinated?
Yeah, it's a great question. And I think we've all been in this weird state for a year. And as Carrie said, it has been exhausting and feels like every few weeks, it's sort of a new assessment of what is safe and what is not safe and what can I do and how can I protect my community, myself, my family. And now we're sort of moving into that, maybe I can start to be a little more relaxed. But I think there's two reasons that people might be sort of feeling cautious. And one is just that it's been a long time since we've sort of been in public. We're, thinking about fall at the school and, sort of thinking like, even if we could safely, do students want to be, shoulder to shoulder in a classroom? How is that going to feel? And so part of it is just psychologically, we are going to need time to readjust. And so I think, sort of baby steps towards that makes a lot of sense if you sort of are feeling that. But I know we're still mostly socializing in the backyard, masks on, distanced. The beautiful weather has helped. So I think we can also kind of just take those baby steps. And the other thing I really want to highlight is that people are at such different places in this regard right now, both for the psychological reasons that you imply. Some people might be itching to go back to an indoor restaurant, whereas others might be much more cautious. But there also might be health reasons that people have different sort of considerations. Maybe they live with a high-risk family member. So even if they are vaccinated, they are, more cautious or have small children at home who have not had access to the vaccine yet. So there's sort of, I think we need to be both thoughtful about our own comfort and what we are sort of comfortable with and ready to do, but also still continue to think about the people around you and your whole community around you to make sure that choices are being made in a way that respects and sort of reflects these different situations that different people are still in.
And I feel like, there's this whole thing, you see these things happening. For example, I'm sure that you got a pit in your stomach when you saw that, what was it? The Texas Rangers had filled their stadium on opening day with fans, and I didn't see a single mask in any of the video that I saw. And there's got to be this feeling of, wait a minute, so life is back to normal? And it's also hard to talk to your kids about, right? Because our kids are not vaccinated. Our kids are not protected. So, Carrie, what are we going to tell our kids right now?
So this is a conversation that, I struggle with, daily, right? So today is the first day back for one of my children in face-to-face school for the first time in 13 months. I mean, the transitions don't seem to end right now, right? And so that's how I frame the message for my kids, that things are changing and we need to be thoughtful about the decisions we make as a family. And, there are going to be people who make other decisions, and those are decisions that everybody has to make, right? And we try and explain our decision making, but, my kids don't have indoor play dates with individuals who don't belong to our pod. Like we're not there yet. And I know that the risks for young children are low, but not every child has the same health status. And, again, respect and reflect that kind of situation, that we're all in a different situation and a different comfort level. So trying to work through those moments with my kids are really just about trying to stay open and honest with them, helping them to understand the basics of the science. I will tell you, my children right now know about masks. They know about hand washing. And it's not just from their mother, the epidemiologist, right? Like all of the schools, even from the distance of at home, they were asking the kids to be practicing wearing their masks before they came in today. So they are having those messages reinforced for them. And so we always try and figure out the things we can do, right? So we did have a little spring break trip. My husband and I are vaccinated. So we drove in the car and we went to Northern Virginia and we were able to enjoy outdoor space. We visited 4 separate playgrounds because that is what my kids love to do on vacation. And we spent an amazing amount of time outdoors, even in the rain, because why not? Like that, it was a different scenery change. They felt a piece of normalcy, and everybody is making their own decisions about that with the availability of the opportunities and resources that they have. So, thinking through the small steps you can do to stay protected and also help your family during these transitional times, it's really key. Our reassessment framework can help with your thought process on that because it's a lot to consider.
So, Liz, in the coming weeks and months, what should we be paying attention to most, do you think, as we make decisions for ourselves?
I think it gets back to much of what we've said for the past year, keeping an eye on community transmission within your local area. We are seeing a lot of variability in cases around the country. And so while it is important to be sort of looking at the national trends and seeing that 20% of people have been vaccinated, it's really important to look at your own local area. And there's huge variation, both in vaccination rates and then also case rates right now. So continue staying on top of that local data and sort of test positivity and cases. Also keep an eye on those age distributions that Carrie mentioned, and especially for families with children, you might see that cases are going up, and it may be that because the adults are starting to be vaccinated, that the cases among kids are really going up. So sort of try to look at it and sort of think about the different age distributions. So just kind of keep an eye on the data, keep an eye on, as Carrie sort of alluded to, what are people around you doing in the sense of mask wearing? I think this is a case where people who have been vaccinated might start sort of taking off their masks and walking around. And that might be perfectly safe for them. But the signaling is hard for the rest of the community. And sort of, I think there's a risk that sort of people will kind of get lulled into a false sense of security and sort of start thinking, oh, right, I don't need to wear my mask anymore. Great. But I think keeping up with that mask wearing. So sort of keeping an eye, again, on your local community and sort of what things are looking like is going to really be important.
Elizabeth Stewart and Carrie Althoff, thank you so much for joining me.
Thanks for having us.
Thanks, Stephanie.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, C.N. Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Hagedor, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.